pushing up. Yeah.
Jen, welcome on in. I see you.
Miami with the scholars mind. PSD, but it's still so kind. Cultural roots in the work is done. Teaching us how care is one, okay. Healthcare vision steady and strong. Helping professionals move along. Find your place, step in your field. Knowledge is power when it's revealed. He don't just teach it, he lives it loud. Builds up rooms and builds up crowds. Shows you how to move with grace. Lead with wisdom, own your space. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Training topics, breaking it down. Bringing real experts into town. From the classroom to the life, he makes the culture feel alive. Teaching truth with art and vision as Dr. Johnson on a mission. Viral moments, but still the same. Support the spirit, not chasing fame. In every room, he shows the code. Respect the space, uplift the host. Rules of engagement, calm and clear. How to show up, how to appear. Community over cloud or trend. That's how leaders truly win. He don't just talk it, he models it. Every coming intentional deliberate the blueprint for what it means to build online communities. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Training topics, breaking it down. Bringing real experts into town. From the classroom to the lab, he makes the culture.
Lady Red, I see you. Welcome on in.
Truth with art and vision. That's Dr. Johnson on a mission. Onyx lens, black and gold. Melanin magic stories told. Lifestyle frames in perfect.
I'm just posting it to my story. I'm sending it out, and we're waiting for our guests. As you guys know, we're coming on in. We're grabbing our daily harmony. We're liking the live, and we're waiting for my guests to come on in. We're gonna do things a little bit differently today. Sub God, I see you. Let me start my song over.
Out of Miami with the scholars mind. PSD, but it's still so kind. Cultural roots in the work is done. Teaching us how care is one, okay. Healthcare vision steady and strong. Helping professionals move along. Find your place, step in your field. Knowledge is power when it's revealed. He don't just teach it, he lives it loud. Builds up rooms and builds up crowds. Shows you how to move with grace. Lead with wisdom, own your space. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Training topics, breaking it down. Bringing real experts into town. From the classroom to the life, he makes the culture feel alive.
Dr. Mime, I see you. Welcome on in. We're here. We're grabbing our daily harmony. We're liking the live. Y'all do the rest for me. Y'all can repost. Y'all can like. Y'all can share it out. I posted it to my story. I'm good. Pals, I see you. Welcome on in. Dr. J, welcome on in. Okay, everybody, hold on. It's moving fast. Let me bring up my... You guys just joining on in. We're going to do office hours with Dr. Johnson a little bit differently today. My guest does not have all day. My guest has a set time. My guest has a job. My guest has things to do. So we're going to do our interview first. Then we're going to do our trending topic in healthcare. And then we're going to wrap it up with some professor tips. Y'all better stay tuned for my professor tips. Don't leave me after my guests leave. Thank you. That was a joke. Y'all supposed to laugh and drop the laughing emojis. Okay, thank you.
Oh, let me get it. Here we go.
Okay, Sub God, can you hear me? Can you see me? What's going on?
I can hear you. I can see you. Can you?
Okay, I can see you. Everybody in the chat, can I get a thumbs up in the chat? Can you hear me? Can you see me? Thumbs up in the chat if you guys can hear me. If you can see me, thumbs up. Thumbs up. You know there's a lag. Sometimes there'll be a lag. Can
Is
you
there
hear me
lag
still?
on
I
me?
just put... No, there's no
I can hear
lag on
you.
you. Hood therapy already seems interesting.
Mhm.
Oh Lord, she said hood therapy already. Perfect. Okay, okay. We're gonna go ahead and get started. Hold on, hold on. Okay, so Sub God, thank you so much for taking the time to step into office hours with Dr. Johnson. I appreciate you. I appreciate the work that you're doing and what you are currently studying for. We need more Black men in higher education. We need more Black men in therapy. We need more Black men in social services. We need more Black men, just representation overall. So, like I said before, you guys, Sub God can't stay. So we're gonna do our interview first, and then we're gonna jump into the regular schedule, my trending topic in healthcare, and then my professor tips. So we're doing a little bit differently today because Sub God has to leave. So first and foremost, Sub God, can you give us just a brief introduction? We know you by Sub God, but we know we got to put on our suit and tie with Dr. Johnson office hours. And yes, sit up.
Oh,
Yeah, sit up.
I
Yeah, we sitting up. Okay. Okay.
got
So
you.
TikTok only knows Sub God, but come on, we trying to yeah.
So,
So, can you
oh,
just give a brief introduction, professional,
absolutely.
educational background, whatever you don't want to share on social media? We all know how to use context clues, but just break it down for us. Let us know who is SubGod. Who is the man behind SubGod? I want to hear your education and professional background. Okay.
Uh, First of all, Doc, I would just want to say, man, many blessings to you for even having me up here. I just definitely feel honored that, I have this opportunity. Thank you, brother. So Sub God is actually a play. I was actually on submarines. I'm a United States Navy veteran. That's where the name Sub God came from. I was actually a submariner. So it's just a play on my military career. So I am a licensed independent clinical social worker,
Mm-hmm.
licensed in Mass, New Hampshire, Vermont, a few other states, more states coming. My education, I have a master's in social work from Simmons University. I have an MBA. I have a background in both business and in social work. Currently, I'm working at a private practice in Maine. I'm also adjunct at Simmons at times. Well, not this semester, but I will be next. I am starting my own practice here in New Hampshire called the Clinical Edge.
Okay.
And so therapy is actually starting to build, and it will be a nonprofit soon. So that's in the works right now.
I love that. Thank you so much. And can I have two people just drop in the chat subject matter expert? Do you guys see why he is here? Did you guys hear the resume? You guys know I'm big on folks coming over here and running down their resume, very professionally. We ain't boasting and bragging. We are showing representation. Gonna have one more person drop my subject matter expert sticker in the chat. Where do you all find the time? I'm ready to do let me tell you something. Somebody asking that too by the grace. Okay, Dr. J, it's definitely the grace. Okay.
Yeah,
I want to jump
that's it.
right.
I'm sorry. Yeah, I'm also in the PhD program, so that's also too. That's why I have to go tonight because I actually have class tonight as well. So that's why
Right.
I'm
Did
up.
you let me, I'll repeat that for you. I don't know if they heard you, but he's currently in a PhD program, Dr. J. So he's doing something else. He's doing something else. So he can't stay too long because he got to go to class at 7:30. You see?
That's it.
That's why he's here. So we're gonna jump right into it. So Sub God, what initially inspired you to pursue business administration and also social work?
So it's interesting because I actually, for undergrad, I had a full scholarship.
Hmm.
I got a full scholarship. So part of why I originally started out with the EMT, and one of my first calls was 9/11.
Okay.
And from my service in 9/11, part of being awarded different things, it came with a full scholarship to school. And business was kind of just a natural thing that I kind of just flowed right into that. I did that for quite a few years, but it didn't feel, I never connected with it.
Hmm.
Did some consulting work, project management work. I left that and went to the military and had a very interesting experience in the military. And
Hmm.
when I got out, just like many veterans, I was trying to find my way. Didn't have that purpose anymore. Of course, at the time, I just struggling with PTSD.
Okay. Okay.
Trying to find a purpose, and I finally found my way into my therapist at the time. I was very cynical. I was a client that nobody wanted, right? Because it was just like I
Hmm.
questioned everything. And I remember she got to the point where, anytime she would say something to me or she would bring up something, I would go home and I would research it. It was so interesting. But again, it was this cynicism because, again, there's this stigma, in our community about, mental health services and therapy and things like that. And I remember she just got so frustrated at the time. She was just like, well, if you think you can do it, why don't you go and do it? And I was
Okay.
just like, well, maybe I will. And actually, that was the beginning of it. We literally built that into that whole therapeutic journey was me actually going back to school
Mm-hmm.
for social work and things like that. Because again, I found a connection with it. I had a social worker before I knew what social work was, as somebody who
Right.
started in the foster care system. So it was literally almost like my life had come back full circle,
Mm-hmm.
and I took off with social work and never looked back.
Nice. I love that. I love that breakdown. I love how you shared, and thank you for being transparent. I love how you share that transparency. I always appreciate folks who come in here and are transparent because that's how you connect with other folks. Some being stuffy and just sugarcoating everything is never, you can't relate. You cannot
Absolutely.
relate. So thank you so much for being transparent. I want to continue diving into it. So you've worked within the area of business administration and you've worked within social work, right? So what challenges have you faced navigating the two fields? I'm sure you've worked them separately, but what challenges have you faced within the two fields, either within business, either within mental health? And we know social workers work a lot within the mental health space. And how did
Mhm.
you overcome some of those challenges?
Um, it's very interesting. Two vastly different environments with some of the same
Very.
struggle, and
Mm-hmm.
it really had to do around with my identity and being authentic to myself.
Mm-hmm.
Um, the business world almost requires demands for you to acclimate and for you to almost push the true self behind. You have to show up a certain way. You have to wear that mask. You have to learn to talk. You have to learn this almost passive aggressive way of being, and that's what we call like business etiquette.
Right.
Social work sometimes it's almost we have elements of that, right? You have to look a certain way or sound a certain way. There's so many times I get the, oh, you don't look like a social worker, or you don't look like a therapist, and I always question that,
Okay.
like, what the heck does a social worker look like? You know what I mean? Because that's what I
Mm-hmm.
am. Well, that's what I do, right? I should say. So I think really finding my own lane within these two different like spaces has been
Right.
a challenge, and I think the lesson that I've learned is not every space is for me, right? Not every space is for me. I know that who I am, just by nature of what I am trying to accomplish, will close doors for me, but they will open others. So being
Right.
okay when certain spaces are not accepting, when there's pushback in certain spaces, there's times where they'll meet, some forward, the kind of counter force, but there's other times it's like, hey, I'm good. I know when to back out and I know when a space is not for me. So yeah.
I love it. Thank you for sharing that. For those of you just joining on in, I forgot to say you guys know a thumbs up or praying hands. That's me acknowledging you guys in the chat. Today we are interviewing a black man, okay, and he's a subject matter expert within social work and within business administration, and currently in school working on his PhD. Okay, so I wanna jump into another important topic as a black man, as a person of color. Okay, I want to kind of briefly go over you navigating the field of social services and mental health. Okay, so what has your experience been like as a person of color working within that field specifically?
Up until this point, it's mixed. There's been so much that I've learned about myself, so much I've
Hmm.
learned about history, my people, like my community, as a
Hmm.
result of being in the social work space. And on the other side, again, kind of going back to, not being fully welcome in spaces. I go through that as a person of color. Also, as a male identified individual in a predominantly female, ran industry, I do run into resistance simply by, point of identity. You know what I mean? So it
Hmm.
has its challenges, but I say that there's something we say in the military. We call it sheepdogs, right? And the
Hmm.
sheepdogs are we will stand in the face of danger. We will face that resistance. I will face that pushback for those who need the services, for those who need the information, because that's why I'm here. And I know I've been
Right.
blessed with the opportunity to be in social work. And I know that someone said something about a year ago, and it really stuck with me. It said, "What is a blessing if you can't make people's lives better with it?" And I think
Mm-hmm.
that's what keeps me pushing through some of the resistance in the social work field. That it's a blessing to be here. It's a blessing to learn and have these opportunities. But really, my goal is to bring that back to, again, the hood. And when I mean the hood is that, again, where I come from, where people look like me, they sound like me. So whatever I have to face in order to do that, then that's just what I'm tasked with.
I love that. Thank you so much for sharing that. Hood. So that's hood therapy. I like that. I like that. Friend Greeting says she loves to see our men out here changing lives. It is important, especially the men of color, not just black men, you guys, Hispanic men, black men, Asian men, the colors. We are colored. Melissa, welcome on in. I see you. Um, Let me ask you something. How does representation and identity impact your work overall as it relates to your clients, especially those from similar backgrounds? What's your impact? Literally, what is your impact?
That right there, that's what therapy was born. But therapy was really born that, and it real quick, and it's a story. I was back home in Queens, and I was literally sitting on the block, and a gentleman that I know had just, I think he was just locked up maybe like a year ago. He had
Mm-hmm.
come to the house to see my brother, and his mother was in the hospital.
Mm,
And it's just, you see it, he was just so like downtrodden. You can tell and you can feel that that brother just had so much on his shoulders, and
mm-hmm.
he was talking to somebody next to me, but I couldn't help but just like jump in and say a couple of words and tell him like there are resources out there for him while his mother's going through this. And I think about 5 minutes into this conversation, now I'll just set the scene for you. Six
Mm-hmm.
five, this, you can
Mm-hmm.
imagine it, big, tall, and he breaks out crying.
Mm,
And there was an embrace there, right? And I asked him like, "How do you feel?" Right? And he said, "I feel better." Like he said, "Yo, hold on right here. I'm gonna go back and get some cigarettes. We're gonna talk a little bit more." And her therapy
mm-hmm.
came out of that because they had never saw a black therapist. They had never saw a black social worker before. And so many conversations started coming out after that. And I remember one of the homies was like, "Yo, yo, yo, who I gotta pay for this?" And I'm like, "Yo, listen, there's other people like me, right?" And that's the thing, just really changing the narrative, having them to see that there are people that look like you, that sound like you, because it's another thing too. And we have to say, when we get into our academic spaces again, sometimes it gets a little corny. I'm like, listen, these are my
Mm-hmm.
folks. You know what I'm saying? These are my folks. I'm there. I'm outside. I still have access to the block because I'm there, right? But for them to see that, and also when it comes to even my young people to know that this is an option, you know what I mean? Like especially my brothers. Like I even had that mentality once that being a social worker, being a therapist, that was a woman's job. You know what I mean? That was a
Right.
mentality because I had never seen it. I'd never been exposed. I never had a black teacher until college, right?
Hey.
So I literally stand in a space for those, and just and I always tell them there's nothing special about me. Me and you, we're the same, right? But just the fact that I occupy a certain space, and then I can stand in that space and they can see me and I see them equally, you know what I mean? That's the impact that I have, just to be able to just be that face that they can
Right.
identify with.
All right. Let me tell you something. When I was in college, at one point I thought about nursing. And like you just
Mm.
said, like social work, you saw predominantly women. Same thing with nursing. I even had some family and friends. Why would you go do nursing? There's no men in nursing. Keep in mind, this is like over 12, 15 years ago. There's no men in nursing. Now, when they see me in healthcare or I in contact with other nurses, Dr. J, would you ever go get your RN license? We need more men. We need
Mm.
more men. So thank you so much for doing the work that you're doing. Thank you so much for being not only just a black individual, but a man within social work. It is definitely important. Okay.
Well,
So
Doctor, real quick before you move on, I gotta throw that
yeah,
back at you because whenever I see someone that looks like me and I see that doctor out there, it's automatic. Like I got, first of all, I gotta learn, brother, because that's the thing. Like when someone occupies a space that you aspire to, it's like a moth to a flame. And then when you look like me, and like I said, Doc, it's like you still look cool. You get what I mean? You still, and then you are not afraid. Yo, Doc, you swag. I mean, you know what I mean? Come on. But the fact that you're willing to shine a light on others, you get what I'm saying? Like, yo, Doc, like that is such a beautiful thing. So while I see predominantly you give other people their flowers, I still gotta say
mhm.
there's something special about what you do just by who you are. Not just because you're a
Hmm.
doctor, you've accomplished things, but you've accomplished amazing things because of the amazing person that you are. So I just had to throw that back at you.
Amen. I appreciate that. Thank you so much. And that's exactly why I do what I do for comments just like that. Let's continue because I know you pressed for time. We only got you for 15 more minutes. But, Sub God, how do you create safe spaces for Black men to open up about mental health? Or if you haven't done it so, how would you? How would you
Mhm.
create safe spaces for your clients?
Now I know it say it so much about meeting people where they are,
Hmm.
but in addition to meeting people where I value where they are. I realize that not everybody has had that exposure. So not only am I meeting you at, you may not, yeah, you haven't sat in these classrooms. You haven't read the case studies. You don't have the license. I get that, brother. But I not only see where you are, but I value that. You get what I mean?
Right.
Because I look at that
Hmm.
not knowing as like, yo, that's a blank slate, brother. Like, yo, let's build together. You know what I mean? Let's challenge some thoughts together. And that's why I think like even this app, because you know what I mean? There is so many opportunities to like build and to learn from each other. But you got to see the value in people. You know what I mean? So again, there's meeting people where I think that's the first step, but it's valuing where they are. I think there's something amazing about someone who may not have been exposed to this. You know what I mean? Who the buzzwords, they haven't been affected by the buzzwords and not
Mm.
everything. You know what I mean? So and I think there's this willingness to learn, and I also see there's this wanting, this needing for connection, but not yet having the words in their lexicon for it. So it's like there's a curiousness and a natural inquisitiveness that people have, and it's just like, yo, listen, I got you. Let's do that. You know what I mean? What do you
Hmm.
think you know? What do you think I know? Let's challenge each other. I tell people all the time. I tell my students, day one when they come in the classroom, one of the few rules I have is you are not to believe anything that I tell you up here. You are
Mm.
not. You are to challenge everything. You are not to believe me. And you are to go home, do your own research, come back with your own answers. And if it matches up, high five. If there's something that, there's a disconnect with, then, let's build together. Let's learn together. And that's how I approach everybody. Everybody is an expert in their own life and what they've gone through and how they see the world. And I see the value in it, even when it conflicts with what I think I know.
Hmm. I love that. I appreciate it. Once again, thank you for the work that you do. Okay. And they said in the chat, challenge absolutely everything. You have to. Ellie Mack, I see you. Welcome on in. Long time. I hope you're doing well. Dr. Lewis, I see you in the chat. Dr. J, I see you in the chat. Her Divine Alchemy, I see you in the chat. Aaron, L, Pals, I see you guys in the chat. Right. For those of you just joining on in, we switched things up a little bit differently today because my interviewee has to leave. He can't stay. He has to go to class for his PhD program. Let me pop him up real quick. He has to go to class for his PhD program. Okay. So we have to kind of switch the segments today, but we're definitely going to do our trending topic in healthcare and then wrap it up with professor tips. But let's continue with this interview. Okay. Sub God, I want to briefly discuss addressing stigma and cultural barriers. Okay.
Mm.
Mental health stigma can be strong in many communities. Okay. What have you seen specifically within the Black and Brown communities? Okay. Being Caribbean, back then they used to go drink some tea and go sit
Mhm.
outside and go read two scripture. Go drink some tea. Go drink
Absolutely.
some tea. Go drink some tea.
Yeah. Yeah, go drink some tea or, or put some Vicks on it in a word, right? Like, I get it.
Vicks Vapor. Go put some. How you know about the Vicks? Go put some Vicks Vaporub.
Yeah,
Oh my gosh.
Vicks is everything, right? But here's the thing. There's value in that. I see that. I understand why individuals have adapted. That's an adaptation. And to me, when they adapted, they were trying to find ways of surviving and living. So I value that. Like I do. Listen,
Right.
it actually there probably is some truth in it. I mean, it's just that nobody studied it, all right? But
Hmm.
what I will focus on is the progression away from the stigma. We are
Right.
starting to have the conversations more, right? And I'm starting to see particularly black men being open more to the idea of the need to go get therapy and things like that. And then there's a cautionary part of that because now not only we're having a conversation, but I also noticed this little thing and I also always want to address it. Now we're telling people, oh, you need to go see a therapist. And I tell them, hold on, it's not that easy. We still got issues with access. The idea of going to find a therapist, it is frustrating. It is overwhelming. How do I find a therapist? If I do find one, do they take my insurance? What kind of modality is the right fit? You get what I'm saying? It is not that easy of walking into an office and saying, and again, the therapeutic process is messy. It can be traumatizing in itself. We got to admit that, right? So, but I want to focus on the strength and progression of my people away from the stigma. It's happening, right? Do I want it to happen more? Yes. Does there need to be more guidance and accurate information with it? Absolutely. But I also embrace the fact that my people do got to be cautious, and you should be, because the mental health system is still part of a system that has done historically and continuously does harm to us. You know what I mean? So I
Right.
understand why the stigmas are there. They didn't just appear out of nowhere, right? So my people do
Mm-hmm.
have to be cautious, right? Because not every therapist is created the same. You know what I mean? So I
Mm-hmm.
mean, my thing is, if we're gonna keep it real, Doc, right? There's
Mm-hmm.
a lot of individuals who are in this role. I don't know, career changes could be. I would, encourage, maybe we do look somewhere else, right? I'm just saying, But here's the thing, like, so I encourage my people, again, like I said, question everything, do your own research, be an educated consumer of whatever product it is, right? So that goes for therapy. Like, yo,
Right.
we got big. I tell people, you walk around with a supercomputer in your pocket. You know
Mm-hmm.
what I mean? We can do research. We can look things up. So when I walk into that office, I'm a little bit more knowledgeable, right? I'm a little bit more comfortable in what I'm about to experience. And look what we're doing here. There are individuals on here who are subject matter experts who can at least, guide you, you know, for the most part, in the right direction.
Right. Right. Thank you for sharing that. A couple more questions before we gotta let you go. Her Divine Alchemy, I see you. Um, how can families and communities better support Black and Brown men when it comes to prioritizing their overall mental wellness? What would be your recommendations with your experience?
Hmm. I think we have to. Oh, that's a. I'm going to take a second on it because I can go so many different directions.
Hmm. Dr. J said we Black therapists also have to do the work to decolonize therapy. Exactly.
Absolutely.
Exactly.
Yeah,
Exactly.
there's a new book that just came out, Decolonizing. I think it's social work supervision. Amazing book. Please hit me up, and I'll send you the title. Um,
Hmm.
I think we have to take control of the narrative as well. The whole
Right.
thing is to call them YNs, and again, we know the importance of words. How it impacts how we think about things, how it impacts how we approach them, and ultimately impacts how we feel about them. My thing is, it may sound corny when I talk about kings and queens, but listen,
Hmm.
I value my black men. I even tell them on him. I was just like, listen, until otherwise noted, I love you from the time I realized you was black. You know what I'm saying? For me, it starts with love.
Right.
There's a part in the National Black Social Workers Code of Ethics, and I love it. And it says that I view every black person as a part of my extended family. That's how I
Hmm.
do social. So yes, I may call you a patient or client, but you are my brother, you are my sister, and I approach it like that. And I think communities have to look at that. That you are not just my neighbor, you are my brother, you are my sister, you are my auntie, you are my grandmother. And when we start approaching, particularly our black men, as our brothers, you know what I mean, as our uncles, with this respect, but also this need for love and caring, we still need that. You know what I
Right.
mean? Despite the
Right.
narrative of the YN or despite the narrative of the angry, aggressive black man. You know what I'm saying? But also, too, Doc, real quick, last point to that.
Hmm.
Also, we have to value some of the qualities that have been traditionally um, have had negative connotations. That aggression that we see black men have, right? There's value to that, right? There's value if if they're given the opportunity to hone that and redirect that. And as somebody in the military, there's something we do real quick. I have like a monthly call with some guys in the prison, and we do something called mastering the extremes, right?
Hmm.
And the
Hmm.
whole idea behind that is on one side of the spectrum, there's where I choose to live my life. And that is peace, that is love, that is harmony. But then the other side of the spectrum, well, we know what's over there. I can hone that. If there ever comes a need that I have to venture there, I want to be as equally comfortable here as I am there. So there's a need to say, okay, we can hone that. That doesn't always have to come out, but I also don't want you to completely subjugate that part. You know what I mean? There's a saying that says it's better to be a warrior in a garden than be a gardener at war. I
Hello.
I want I want that duality. I'm both a warrior and a gardener, and I actually do garden, but I also spend time at the range, and I also do the quote unquote manly things that we think, because I
Hmm.
think there is a need to embrace the multifacetedness that is black men.
Right. Right. Thank you so much for breaking that down. For those of you just joining on in today, we are interviewing Sub God. We have to do things a little bit different today. He has to go. He got to go to class. Okay. But licensed clinical social worker and masters of business administration, subject matter expert, and black man, person of color. You know he had to step into office hours with Dr. Johnson. You know we had to talk to him. He has to go at 7:30. But I just have two more questions for you. What are some of the biggest systemic challenges you've encountered within social services? Because you guys, let me before you answer, I've said this before in the chat too. Teachers and social workers, those are two fields that your job your job was made harder for you guys, just not on purpose, just because of the nature of the work.
Mhm.
Okay. I know you got to go, but briefly, can you share with us? Once again, I'll repeat the question. What are some of the biggest systemic challenges you've encountered as it relates to your work within social services? Now, social services is broad, but you could take us through there.
The system itself. The system
Mm,
itself. I think it's again about accurately looking at what our reality is. A lot of
mm-hmm,
individuals say the system is broken. And I said
mm-hmm.
we have to look at it accurately. The system is not broken. The system is working exactly how it was designed. It was not
Hey,
designed for us. It does not include us. It excludes us at every single point in time. And for me, the challenge of working within a system while actively trying to dismantle it, while actively trying to guide my people through it, it is when I say it is a juggling act, that's exactly what it is, right? Never forget that one of our purpose, well, at least for me and my vision of like social justice and social work, is dismantling these systems. So the system
right,
itself, the system and how wonderfully it was designed to work against us, and it is working. It is working, but we're we're actively fighting back. And so I guess also the challenge is, staying motivated, doing the work and not letting the work do me.
right, exactly. Last question before you go. I ask all of my guests this question. What is your overall why? As it relates to the work that you do, what is your overall why? Before you answer that briefly, Dr. Martha, I see you. Thank you so much for being here. Jackie, I see you. Thank you so much for being here. Today, you guys, we were switching things up. We're doing my interview first, then we're going to get into my trending topic in healthcare, and then we're going to wrap it up with my professor tips. But my interviewee, he has to leave. He has to go to class. This man is a subject matter expert, and he's adding more to his plate like what a black king does. Okay. He's in a PhD program and he's going to class. The reason why I'm emphasizing that is because there's so many people who are come across who I'm in trying to force them, hey, go back to school. There's so much being stripped away from us, but that DR in front of my name is not going anywhere. Do you see that LICSW MBA behind your name is not going anywhere? There's so much being stripped away from us. We're not going to take it there. I want you to answer your question. Sub God, I appreciate you. Thank you so much. But
No
before you
problem.
go, what is your overall why as it relates to the work that you do and as it relates to the reason why you continue to show up in the spaces that you work within?
I owe a debt. I owe a debt.
Mm,
With that. I grew
mm-hmm,
up when I say I grew up in the foster care system. I was
mm-hmm,
partially in it, back with my family, but my foster family was an amazing, amazing couple that took me in. You know what I mean, and showed me what love was about. All throughout
mm-hmm.
my journey, I had individuals who have done their best to shield me, even when I went against it. You know what I mean, and I owe a debt to those people who paved the way for me. When they said we stand on the shoulders of giants, like I'm paying that back, and
Mm-hmm.
I'm doing it my way, and things like that. And I owe my people. I will never give up on my people because I owe them. So, and that debt will be paid off when what I mean. I'm 6 feet. So every day I wake up, no matter how tough it is, I realize that I have a certain charge, and I have a certain debt that I need to pay off, and that just keeps me going.
Okay, amen. I appreciate that. Sub God, I know you got to go. You said you have a hard stop at 7:30. Once again, I appreciate you so much for being here. I appreciate you taking the time in your busy schedule to come into step into office hours with Dr. Johnson. As you know, I host monthly conferences once a month. So I'll definitely be reaching out to you and seeing, what how I could use your services and your subject matter expertise for an important conversation as it relates to black men, brown men, just men showing up in general. Okay, because represent men need to be represented more. Men need to be represented more. Okay. So once again, thank you so much for being here, sir.
Thanks,
Okay.
Doc. And I just want to say real quick, whatever you need, you call upon me. It is both a privilege and an honor, and I'll answer that call every single time. And I appreciate everybody that showed up. Thank you. I love you all. Okay,
I
take care.
appreciate you. Thank you so
Bye bye.
much.
All right, take care.
All right, now that was okay, Dr. Martha. I see you. Thank you so much for being here. You guys, a thumbs up or a praying hands is me acknowledging you guys in the chat. I'm trying not to interrupt my guests, so I wasn't ignoring y'all. Y'all know the drill. A thumbs up or a praying hands was me acknowledging you guys in the chat. Miss Tanya, I see you. Thank you so much for being here. Dr. J, I see you. Thank you so much for being here. Now we're gonna get into my trending topic in healthcare. You guys, like I said, I do things a little bit differently today because my interviewee had to leave. So we're going to go back to the beginning. We're going to do my trending topic in healthcare. In each of my office hours, I go over a trending topic in healthcare. I interview a special guest, and then I wrap it up with some professor tips. So my trending topic in healthcare is one of my moderators still here? I don't know. Moderators, you still here? Moderators? Can we pin? I don't know if my moderator's still here. I can't type it real fast. But my trending topic in healthcare. Mental health is now the world's top health concern. You guys know I got multiple screens. Dr. T, I see. Dr. T, I just responded back to your message on Instagram. I'm not even going to tell your business on here. Dr. T, I just responded back to you on Instagram in that message you sent me. We have to invest in ourselves, Dr. T. Okay, I'm not going to say too much, but we have to invest in ourselves. Okay, and what we put in is what we receive. What we put in, Dr. T, is what we receive. So when you go and read my message, that's what I'm relating to. Okay. So I know it may message me, Dr. T, Health Hub with Dr. T. Okay. My trending topic in healthcare. Mental health is now the world's top health concern. Okay. And this was a poll from 31 different countries. Okay. Mental health is overtaking cancer. Once again, mental health has overtaken cancer as the world's most cited health concern in a global survey, rising from 27% in 2018 to 45% in 2024 by respondents in 31 countries. So they went to 31 different countries and collected data and information. What is the top health concern? And surprisingly, mental health is at the top of the list. Drop down in the chat. Are you guys shocked? Can I have 2 or 3 people drop my mental health stickers down in the chat? Mental health matters. And now we're seeing that it does. Mental health matters, and now we're seeing that it does. Okay. Now, some of the categories I'm going to share with you guys. Okay. But the first one, Dr. Mimi, welcome on in. I see you. Mental health was 45%. Miss Jackie, I see you. Thank you so much for dropping that sticker. Miss Tanya, Aaron, I see you. Mental health was 45%. Cancer was number two, 38%. Stress was number three at 31%. Of course it was. Look at the world we're in. Everybody is stressed. 31%. Number four was obesity. Of course it is. We're all eating. Why? Because we're stressed. Why? Open your front door. Next up was drug abuse at 21%. Of course it is. Folks are on drugs. Why? Open your front door. It's a lot going on. We have to make a lot of the situation, okay, you guys? We have to make a lot of the situation. But I'm just so grateful and glad that mental health is at the top of this list. The reason why I'm glad is because, like we were saying previously in the interview, there was a time when folks didn't acknowledge mental health. There was a time when our parents and friends and folks around us were telling us, oh, go sleep it off. Go drink some tea. Now, mental health is now the world's top health concern. What else was on that list? Heart disease at 16%. What else? Alcohol abuse at 16%. What else? Smoking at 12%. The COVID-19 was 11%. Dementia was 9%. And STD, sexually transmitted diseases, was 3%. Once again, mental health is now the world's top health concern at 45%, and that's collected data from 31 different countries. Okay, so what does this mean for public health overall? Okay, I got 5 bullet points. What does this mean for public health overall? Mental health is now a core health system priority, no longer a specialist concern. This is a whole population challenge. It's not just here in the US, this is all over. Number two, demand is outpacing capacity. Workforces, services, and funding are not keeping up. They can't keep up. A lot of people are dealing with mental health situations, which is why mental health is now the number one world health concern. Number three, prevention matters more than ever. Early intervention, schools, workplaces, and communities are critical, which is why social workers are important, which is why teachers are important. Inequalities are widening. Okay. Women, young people, and those in deprived communities carry the greatest burden with the least access to support. Hey, I want to repeat that. Women and young people and those in deprived communities carry the greatest burden with the least access to supports. And the last one is health systems must adapt from acute care models to integrated long term support. Okay. Mental health is now the world's top health concern at 45%. Can I have Lady Red and Miss Jackie? Can you guys drop the mental health stickers in the chat for me, please, before I continue? Oh, today gonna be an early office hours. We wrapping it up. I can go have dinner early. Oh, this is good. Hold on. Hold on. We are going over to Dr. Kimberly. I see you. Welcome on in. We just wrapped up my interviewed guest and we just wrapped up my trending topic in healthcare. And now we're about to slide over into my third segment, which is Professor Tips. I have jobs three jobs that I want to share with you all today. I'm constantly coming on here. Dr. Douglas, I see you. I hope you're doing well. Thank you so much for stepping in. I have three jobs that I want to share with you guys, okay? I'm always on here posting up different job titles and posting up the employers of where they are hiring, okay? But I want to start, in my office hours, I want to start highlighting certain roles and kind of briefly going over the job description with you guys to let you guys know, hey, this is out here, go apply, or tell somebody go apply. Miss L, I see you pinned that. Perfect. I see you. Thank you so much. Hold on. You faster than me, moderator. Hold on. Damn. Let me get my thing pulled up. First one. What did my moderator say? Okay, my moderator said oncology. Hold on. Perfect. I see. Okay. Professor tip number. My moderator is telling me stick to the program. Don't go off track. You better stick to the program, nigga. The first one is first job title, a clinical innovation specialist with one oncology. The way how my moderator spelled it, perfect. Oh wait, there's missing an E. But one, the word one oncology, one oncology, excuse me, altogether. One, okay, bingo. This why you shout out to my moderators. And if you are a live host, make sure you have some supportive, dedicated moderators. Shout out to my moderators, Miss L. First up, first position is clinical in clinical innovation specialist. Y'all getting me nervous. Hold on. It's the passion coming out. Okay, so the job description briefly: the clinical innovation specialist reports to the clinical innovation manager and is part of the clinical team at one oncology. This individual plays an integral role in supporting the execution of team strategic goals, of equipping every provider with the resources, tools, and technology needed to achieve clinical excellence within cancer care. Her Divine, what you trying to say? The Comic Gang said, let's get it. Let's get it for real, Her Divine. Okay. Not all of these positions, specifically, you don't need a whole bunch of degrees. This is just a bachelor's degree. Okay. They want you to have experience with identifying processes and inefficiencies, implementing process improvements. 3 years of experience within a similar role will suffice. Project management experience is desired. They never said required, they said desired. Once again, this is one oncology, it's a clinical innovation specialist. Professor tip number two. Moderator, professor tip number two. Which one you want? Oh, moderator, can we do Vibrant Health, the one in New York? Vibrant Health. I'll pull it up right now. So, Kirsten, welcome on in. We just wrapped up my interview and we just wrapped up my trending topic in healthcare. I'm doing my three professor tips, three job titles, and sharing just a brief description of the job title and telling my folks y'all better go run and apply to these jobs. Thank you so much for grabbing your daily heartbeat. So, Vibrant Emotional Health formerly was the Mental Health Association of New York City. Okay, and they have quite a few remote opportunities. One that stood out to me that I want to share with you guys today is a mobile crisis manager. A mobile crisis manager. The salary is 58,000 to 92,000. Okay. Position overview. You will play a vital role in fulfilling New York's 988 single point access for mobile crisis team for the city of New York by identifying, processing, and facilitating mobile crisis referrals to the relevant teams. You guys are always asking about these different jobs in healthcare admin. I'm just sharing. I just wanted to come on here and share three. In addition to managing a team of staff dedicated to processing mobile crisis referrals, you will also support the broader Here to Help Connect staff to develop a robust understanding of mobile crisis services, oversee day-to-day operations and functions, coordinate and manage regular communications and outreach, strong clinical assessment skills required, a master's degree. The first one that I shared with you guys was a bachelor's degree. This one is a master's degree. Okay, and 3 years of experience within crisis intervention or administrative supervisory duties within a clinical setting. Okay, that is the mobile crisis manager with Vibrant Emotional Health. Okay, they are out of New York. However, the job is remote. The third one that I want to share with you guys, the last one, but then we're going to wrap up, is DoorDash. I have a large community on here. Not everybody is in healthcare. Some people are in healthcare, some people are not. So I wanted to make sure I included a little bit of something for everybody. Okay. The next company, the professor tip number three is DoorDash, and that is a senior support specialist for their live operations department. Senior support special. Okay, my moderator bigging y'all up. My moderator said apply to that manager position, but it's actually the senior support specialist for their live operations. Okay. Let me bring up the responsibilities. You will serve. Not you're not a driver. Okay, this is a remote opportunity behind the desk. Okay, you will serve as primary shift owner during assigned hours, ensuring operational stability and immediate resolution of issues. You have 3 years of experience in dynamic shift-based environments. For example, that could be e-commerce marketplace, fulfillment, or retail management. You are comfortable balancing multiple priorities in a fast-paced setting. You will support a critical operational function with DoorDash's new vertical businesses, work cross-functionally across multiple teams and service areas. This was $21 to $31 an hour, a little bit of something for everybody. I'm trying to see if there's any degree. They didn't put no degree required. Just have 3 years of similar experience. Okay. First one that I shared with you guys was clinical innovation specialist with One Oncology. The second one I shared with you guys was a mobile crisis manager with Vibrant Emotional Health. And the third one I shared with you guys was a senior support specialist for their live operations for DoorDash. Y'all go find you a job. Please go find you a job. Their jobs are out there. You got to do the research. Jobs are definitely out there. We have to do the research. We have to do the research. We have to search for the jobs. This was a quick office hours. Any questions in the chat? Miss L, I see you. Thank you so much for being here. Any questions in the chat before I go? We wrapping it up at 45 minutes. This was quick and easy. Dr. T, too quick. Too quick. I don't have nothing else for y'all. Let me play my song my friend made for me. I don't have nothing else for y'all. Oh. Nothing else. This was a quick one. Folks are talking about, an hour, I am rapping. Yeah. PSD, but it's still so kind. Cultural roots in the work is done. Teaching us how care is one, okay. Healthcare vision. I appreciate you guys all for being here. Thank you for stepping into a quick office hours with Dr. Johnson. Miss Tanya, I see you. Thank you so much for taking the time to step into office hours with Dr. Johnson. Y'all know I normally don't do my office hours this fast, but today we're wrapping it up. We are definitely wrapping it up. Dr. T, shout out to you. Dr. T, can you come up and speak real quickly for 2 minutes, or are you driving, or are you still at the office? Because I want you to come just briefly share with them what you are doing this weekend, because what you're doing this weekend is big. Can you briefly share with the people what you're doing this weekend, or no? Or are you busy, or are you driving? Because I have a 10-minute to fit going down the road. Okay, don't even worry about it. Dr. T is hosting a great conference. I think she's calling it a conference. A great conference this weekend. Is this weekend, right? It's going down. It's supposed to be this weekend. Dr. T, I think you should get a degree in public health, because the work that you're doing, Dr. T, it encompasses way. I know you are a physical therapist. Yes, this Saturday you're hosting a conference in Texas. I know you are in physical therapy, but the work that you're doing, Dr. T, you are touching on so many different communities. I think you should consider a degree in public health, a MPH. I think you definitely should. I know a lot of MDs who are practicing medical doctors, but they either go back and get an MBA or they go back and get an MPH. I think you need to go back and get that MPH. That'll really open up some doors for you. Thank you so much for being here. We wrapping it up. Hold on. Rain, I see you. Rain, we wrapping it up. We just went over my trending topic in healthcare. We interviewed my guests. Urban Eye Candy, I see you. Welcome on in. We went over my professor tips. Every Tuesday, 7 p.m., office hours with Dr. Johnson. Then once a month, I do my conferences. As we all know, the month of May is mental health awareness. So as you know, my next conference for May is going to be mental health awareness related. Okay, that's all I'm going to share with you guys. But I'm currently working on my guests. I haven't started working on my questions or what topic I want to focus on yet. But my next conference will be related to mental health awareness and the importance of mental health and representation within mental health. Why? Because May is Mental Health Awareness Month. Y'all, we wrapping it up, okay? There's been no feel, knowledge is power when it's revealed. You don't just teach it, he lives it loud. Can I have a couple deuces in the chat before I go? A couple deuces. A couple deuces in the chat, come on. And can we get to 20K before I go? 20K likes before I go, and deuces in the chat. Trending topics, breaking it down, bringing real experts into town. From the classroom to the life, he makes the culture feel alive. Teaching truth with I see you, Dr. T. I see you, her divine alchemy. Viral moments, but still. Y'all hear my song that my friend made for me? Support the spirit, not chasing fame. In every room, he shows the code, respect the space. I see you, Urban Eye Candy. We checking out. Okay, I'm almost there. 20K, we out. Community over cloud or trend. That's how leaders truly win. He don't just talk it, he models it. Every comment intentional, deliberate the blueprint for what it means to build online communities. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Trending topics, breaking it down, bringing real experts into town. From the classroom to the lab, he makes the culture. I appreciate you guys. I'll see you next Tuesday. Office hours with Dr. Johnson with another guest. This guest is going to be good. And this guest gonna have a lot to say. So prepare next Tuesday for my guest, Miss Tanya. I'm gonna see you next in your painting class. I call that a painting class. That's not a live. That's a painting class, Miss Tanya. I'll be looking forward to it. L, I see you. Thank you so much. Lady Red, I'm done. Go to class. It's time for your class. Miss Jackie, I see you. Thank you so much for being here. We're wrapping it up. I'm gonna see y'all next Tuesday. Your guests are always good and can't wait to Congo again. Her divine, her divine, her divine. What am I gonna do with her divine alchemy? What am I going to do with her divine alchemy? You know when you have a TV show and you have a moderator or a host for the show, but that moderator or host has is the comedic relief. Her divine alchemy would be that play that perfect role. I gotta figure something out. Her divine, because the people like when me and you go back and forth. I gotta go, you guys. Now my brain is going 10 miles an hour. Have a blast. That's what you do. I appreciate you. Thank you so much. Taylor, I'm hopping off, Taylor. So, Taylor, you just joined my live and I'm hopping off. I need you to go live and go do your yoga. Okay? We waiting on you. We need you. Everybody have a good night.
It's the culture, feel alive. Teaching truth with art and vision. Let's stop the...
You just got off work. I'm sorry. You know that work come first. Them bills come first. Hello. Them bills come first. Y'all gotta go. Y'all keeping me here for no... You guys, and when I don't have no agenda or no meeting, I get nervous and shy. I don't know what to talk about, so I gotta go, okay? Taylor laughing. Bye, y'all. I gotta go because my agenda is done.